And what we're going to do today is just show you a setup that we have for a procedure that we've developed here at my clinic, referred to as brain driving, which is a very efficient system for nudging the brain into more efficient functioning. The procedure we're going to show is balancing the frontal cortex, in which getting the right and the left frontal areas of the brain to talk to themselves efficiently. So we're setting this up to use brain driving to balance the frontal areas of the brain. And typically what we would do, of course, is we would have a preliminary assessment, so we would know what kind of degree of imbalance we had in the frontal cortex and in what brainwave bands the imbalance, where we find the imbalance. In some areas, imbalance gives rise to predisposition to depression. Others, problems with planning, organizing, sequencing. Other imbalances associated with defiant behavior in children, but they're all implicated in efficiency and optimal performance. So if an athlete, for example, has an imbalance in the frontal cortex, that's affecting efficiency. A lot of ADD kids, for example, have imbalances in the front part of the brain, and as all parents of ADD kids know, fine motor problems are very common with ADD children. So when we get that balanced with an athlete, then we can proceed with the optimal performance aspect of the training. Looking at the theta amplitude on the left, that's the left scale there, and theta amplitude on the right scale. And the balance board is showing me the degree of balance between those two. And when it's where it should be, you can hear that tone come on. And my database indicates that you want the balance to be within 15%. You don't want either side to be out of balance more than 15%, because that's usually indicative of some sort of problem. When we're using these brain driving techniques, usually people will report positive effects within 3 or 4 sessions. It's not over then, don't misunderstand me, but they know they're on the right track. Sometimes we get pretty remarkable changes associated with the first few sessions. We just had a client in here earlier who reported a very dramatic impact on a performance that she was involved with after a session or two, in which we corrected an anomaly that she had in brain activity. A child, when they first do this procedure and they realize they have some control over this, that really empowers them. So there's a lot of secondary effects associated with this, knowing that they can exercise some control over their intellectual functioning, and that's very empowering for a child.